Well, it's a grim look at the death toll in Oklahoma brought on by opioids. But we find the situation could be worse without volunteers trying to keep people alive and get them away from fentanyl. Cooper Rayburn is a volunteer with Shred the Stigma, a nonprofit that delivers harm reduction kits to people across Oklahoma.
Fentanyl testing kit, so that way you can test your drugs to make sure there's no fentanyl in them.
Test kits, Narcan, syringes, and more to help keep people alive.
I want to be able to do for people what people couldn't do for me.
He experienced IV drug use less than 8 years ago in Oklahoma City when harm reduction efforts didn't exist.
What led me to sobriety? Just trying not to die, really. I mean, a lot of jail, a lot of overdoses. I've been brought back by Narcan several times.
Waking up to paramedics or in the hospital thanks to Narcan.
You couldn't just get Narcan. You know what I mean? You could not just get clean syringes.
Now Cooper and others like Drew Cook, who founded the nonprofit, are filling that gap.
As of this morning, we are at 1,024 overdose reversals in total since we started in July of 22.
Participants get a survey with each kit. The surveys let Shred know if the Narcan was used for an overdose and if they need a refill. Cook said right now only about 45% of people complete the survey.
So that 1,000 is likely a very conservative number.
Despite all the work Drew, Cooper, and others are doing to save lives, more Oklahomans are dying from fentanyl overdoses. According to new data from the Families Against Fentanyl, Oklahoma is one of the top 4 states seeing the highest increase of death in the past 12 months. In Oklahoma, it's an increase of 55%. Data gathered by Families Against Fentanyl found that 680 Oklahomans died of a fentanyl overdose in the last 12 months, compared to 440 Oklahomans dying in the previous 12 months.
We are extremely grateful that we've been able to be there for our participants and that they're still with us. On the other hand, we're sad that there is such a huge uptick in overdoses that are occurring within our community.
But he says it takes a community to help people out of drug use.
And I just remember wanting someone to treat me like a human. If you are at that point where you want to do something different, you need help to do that.
And Shred the Stigma has seen what can happen when an Oklahoman gets the help they need.
We are seeing people who not only are getting balance back within their life and stability, but they're also engaging in social services again. Maybe they were unhoused when we first met them, now they're getting housed. We are able to connect them with other resources within the community.
With every delivery, Cooper knows a life like his could be saved, but they also know there's a lot more work to be done. Shred the Stigma has expanded their services from the metro to rural areas of the state. As far as Lawton, they're working with the state of Oklahoma and 2 tribes to distribute harm reduction kits. And to help pay for those supplies, the group is holding a fundraiser in just over a week. You can find more information on that at okcfox.com. For a Good Day OK, I'm Jameson Keefover.